A year after the government's response to the Defence and Veteran Suicide Royal Commission, the Minister in charge is unveiling a major step forward with the launch of a $78 million veteran wellbeing agency. Let's head to Brisbane now. We're joined by Rod Martin from GO2 Health. Rod, good to see you. What signal does the creation of a fully funded veteran wellbeing agency send to Australia's veteran community?
I think this is the piece where things are linked together, Ahron. We've got a number of strategies that have been going on for a number of years. We know that the Royal Commission was about veteran suicide and the really high numbers of that. The Wellness Agency, I think, is a targeted way now that funding, opportunity, thought, perhaps a plan of action can go into the veterans hubs and also into the community around that really does the heavy lifting around the healthcare.
I was fortunate enough in 2013 to be in Afghanistan as a journalist, and I would speak to a lot of the soldiers who were there and ask them, how much longer are you planning to be here? And they would say, I want to leave as soon as I get back to Australia. And I'd say, next, what's next? And the answer would be, I'm not really sure. So how is improving, I guess, the transition from military service to civilian life such a critical national priority?
That's a really good question, Ahron. It's one of those really complex things where people put their hand up to serve their country. At GO2 Health, we're really in that space of looking after the medically discharged patients, the people who were injured through their service, whether that's physically, psychologically. But a lot of the men and women who serve our country then have a unique set of skills. Sometimes they don't translate directly into the rest of the community. And very often those skills are not recognised. There's been a rhetoric around veterans are broken, they're difficult or they're injured or they can't function. So that transition piece where a veteran or a military person learns how to live in society again, how to work with civilians and where they perhaps fit in that order is very new. And this transition piece, we've noticed, there's about 18 months post-transition where veterans can really struggle. And it's at this point is the highest levels of PTSD and depression, anxiety really start to hit them, and those mental health issues can go really crazy. So a smooth transition about how to engage, how to look after your family, what working looks like, how to live in a completely different culture. And in some way that the whole environment is so totally different. It's all very new.
Yes, it's something you wish that those who send our people to war would think about the other side and the ramifications, right? Because talk to us about the gaps in veteran support that still need urgent attention across Australia.
I think there's a lot of rural and remote veterans, and those people perhaps they're living rurally and remotely because they want to be away from society or people. So that's a big part of it. Within the culture itself, I mean, recently the acts focus on perhaps the compensation part, but there's a very big push now with DVA to move more into that rehabilitation and repatriation side. How do we get somebody to repatriate themselves? But there's not many organisations really doing the heavy lifting around perhaps the healthcare. The Minister made a point on Tuesday, which we were very pleased with, which is around the 8 domains of wellness, which include healthcare and mental health care. They also include all the other areas around family and around jobs and around education. And I think that's a really substantive piece of work. However, we really need focus on the healthcare so that people can access all of those other things in the way they're intended, which is where GO2 and Reforge model was built, was perhaps to try and fill that gap.
It's interesting what you're saying there, and the questions I've got here are really similar to what we're seeing in the football community as well, where footballers end their life cycle as a footballer and they've got all these amazing skills and they've been paid really well, and then they enter the civilian world, and what's to do? How can Australia, I guess, better integrate the physical, the mental, the social health services for veterans?
I think there's probably a bigger piece of work around this, Ahron, which is that of kind of noticing each other. There's perhaps, societally, we've spent a lot of time in the past with volunteer organisations or the way things function. Now we're in a place where we really need to step back and perhaps identify and notice who people are and what they've done and what the value of that was. And that's an external look rather than an internal look. So I think, you're asking a much more difficult question. I came from elite sport. That's one of the reasons why I understand that, perhaps that major adjustment that goes on. We also know a lot of Australia will just go, well, you were paid well to do your job. You were famous or you had those things. Why should we give you any more? So there's perhaps a complex needs question there.
Yeah.
Yeah.
It's a tricky one. Yeah, well, talk to us about what you're doing at GO2 Health, I guess, to fit with this challenging landscape.
Thanks. Look, GO2 Health was put together 16 years ago. Myself and Dr. Kieran McCarthy, who was a serving member and went to Afghanistan, was in Timor. When he left, he and I were old friends, so I grabbed him and we really put together the Reforge program for veteran care. We look after about 7,500 veterans at the moment. Average age is 36 years old. And our whole idea was a whole biopsychosocial model, something that integrates allied health, medical, and really does the treatment part.
Yeah.
So this is the boots on the ground, eye to eye. What does somebody need? What's next? How can we help you through that? And then how can we get you back to your family, back into work? How can we get you to identify the organisations, the ESOs that you can then go to really work with?
Yeah. All right.
That's the kind of fundamental part. Yeah.
Rod, thank you so much for your time here at Ticker today. Thank you.
Thanks, Sam. It's been really great to talk.